Interpreter is Meresha Owiti. The new COVID-19 variant, which has been named Omicron, is taking the world by a storm, with nations now rushing to put travel restrictions as a way of managing the spread of the variant. Speaking today in Kisii, Health Principal Secretary Susan Mochache says there is no cause for alarm yet, but added the COVID-19 protocol still needs to be adhered to. KTN's Health and Science reporter Saada Hassan begins our broadcast tonight with that report.
Strategy and budget. Speaking today will be as ever.
Just a day after the World Health Organization declared the Omicron variant, or B.1.1.529, as a variant of interest, several countries have already taken up more stringent measures to prevent the spread of the virus. Most new cases of the Omicron variant have been detected in the United Kingdom, Italy and Germany. Other countries that have reported cases are Belgium, Israel and Hong Kong. However, the World Health Organization has warned against taking drastic measures without proper protocols.
What we do know is that this variant has a large number of mutations. And the concern is that when you have so many mutations, it can have an impact on how the virus behaves. So right now, researchers are getting together to understand where these mutations are and what that potentially may mean for our diagnostics, our therapeutics, and our vaccines.
So far, at least 10 variants have been reported globally, with Omicron recording more mutations, followed by Lambda variant, Delta variant, and the Gamma variant. Major travel destinations, including the European Union, Japan, Australia, the United States, and Canada, have moved to block flights from some of the African countries. Here in Kenya, all incoming travelers into the country must possess a negative COVID-19 PCR test taken 96 hours before arrival into the country. According to PS Susan Mochache, vaccines are still effective and there is no cause for alarm yet.
The vaccines that we have still remain useful and are, they are resistant to all the variants that have been coming. We cannot continue with an economic depression because of COVID-19. Families must continue to interact. People must continue to move. What is important is the adherence to the protocols, making sure that the basics of wearing masks, of washing hands and social distance is maintained.
While only dozens of cases have been identified so far, news of the variant is already sparking fears around the world. As more research is being conducted globally, the virus is likely to stay with us longer. Saada Hassan, KTN News.
Right, and of course, we're really keeping an eye on that story and what's happening across the world and the reaction there.